Welcome to this explainer. Today, we're decoding the world of electrical stimulation. We are going to demystify the actual science, the regulations, and the clinical realities behind all those popular e-stim devices you keep seeing online. Let's dive right in and rely strictly on the data to separate medical facts from infomercial fiction. So can a quick electrical zap actually cure your chronic pain or, build your muscles while you sit on the couch? Look, dealing with chronic pain or trying to get in shape is incredibly frustrating, which makes these flashy, portable little devices pretty tempting. But we've got to ask, does the underlying science actually back up all that marketing hype? Well, this explainer is going to equip you with the exact knowledge to answer that. All right, here's a quick look at our roadmap. We're going to start with the electric device trend, break down TENS versus EMS, explore exactly how TENS targets pain, look at the medical consensus, and finally, review the FDA rules on EMS safety. Okay, starting right off with part one, the electric device trend and this absolutely booming market. If you've scrolled through social media lately, you've definitely seen this explosion of over-the-counter electrical stimulators. It's wild. On one hand, you've got gadgets promising instant arthritis relief, and on the other, vibrating belts swearing they'll give you a six-pack while you literally eat chips on the couch. With the consumer market growing this fast, we really need to look at the source material to separate physiological reality from just, clever advertising. Moving right along to part two, TENS versus EMS, and knowing the difference. Now, this right here is the core contrast that trips everyone up. On the left, we've got TENS. TENS is strictly about targeting your nervous system. It interacts with your sensory nerves to mask pain. But on the right, that's EMS, or electrical muscle stimulation. Unlike TENS, EMS targets your motor nerves to physically force your muscle fibers to contract. A good rule of thumb? If it stops a pain signal, it's TENS. If it makes your bicep twitch, it's EMS. All right, on to section 3. Let's look at exactly how TENS targets pain through the gatekeeper effect. So according to the Cleveland Clinic, TENS, which stands for transcutaneous electrical nerve stimulation, is basically a therapy that uses a low-voltage electrical current to provide pain relief. I know, it sounds a bit like sci-fi, right? But the reality is that a controlled low-voltage current applied to your skin can actually intercept the way your central nervous system processes chronic pain. The biological process here is actually super fascinating. First, you apply these sticky electrode pads near the area that hurts. Then, gentle electrical impulses are sent right through the skin to your nerve fibers. And step 3 is where the real magic happens. Your body responds by blocking those pain signals from traveling up your spinal cord while also triggering your brain to release endorphins, your body's built-in painkillers. To put it simply, think of it as a gatekeeper. When you stub your toe, a distress signal travels all the way up to your brain. But a TENS device, it sends a non-painful sensory signal along different, much faster nerve fibers. Because that TENS signal gets there first, it reaches the spinal cord and literally slams the gate shut on those slower pain signals. So instead of a throbbing pain, you just feel this sort of gentle tingle. Which brings us to section 4, the medical consensus. Does this thing actually work? To find the objective truth here, we've got to look at established clinical guidelines, specifically the ones published jointly by the American College of Rheumatology and the Arthritis Foundation. They evaluate absolute mountains of clinical trial data to figure out what legitimately helps patients with chronic conditions like osteoarthritis, totally free from any marketing spin. And here is what they found. They state that the guidelines provide conditional or mixed recommendations regarding the overall efficacy of TENS for osteoarthritis. Basically, the medical consensus is definitely not a sweeping endorsement. TENS is certainly not some guaranteed miracle cure for joint degeneration. In medical terms, a conditional recommendation means that while some patients absolutely do experience real, measurable relief, it doesn't work for everybody. And it's definitely not a replacement for physical therapy or proper medication. It's just a tool in the toolbox, not magic. Finally, section 5, FDA rules and EMS safety, and how they protect consumers. Now, let's pivot to EMS. The reality of the EMS market is starkly divided. On one hand, you have strictly FDA-approved uses, things like muscle re-education and preventing atrophy. This is stuff used in legitimate medical rehab when a muscle literally forgets how to fire. But on the other side, we see illegal marketing claims left and right, effortless weight loss, rock-hard abs while watching TV. Yeah, the FDA considers those claims completely unproven and highly deceptive. In fact, the FDA is incredibly explicit about this. They state,
The FDA has not cleared any EMS devices for weight loss, girth reduction, or obtaining rock-hard abs. The science on this is absolutely definitive, guys. Real muscle growth and fat loss requires systemic metabolic processes. Actually doing the physical work. Simply strapping a battery pack to your stomach is just not going to give you a six-pack.
So, we've covered a lot of ground today. You now know the crucial difference between TENS for your nervous system and EMS for your muscles. You know TENS is a pain gatekeeper, not a miracle cure, and that EMS is meant for actual medical rehab, not effortless abs. As we wrap up this explainer, I want to leave you with this thought. Now that you actually know the underlying biology, why are we as consumers still so easily tempted by the promise of a technological shortcut to health? Thanks for joining me, and keep questioning the science.